Welcome to Martha Runs the World, a podcast with a new take on running, fitness, and all things health-oriented. I'm Martha Hughes, your host, and each week I present a new topic that is of interest to all runners. Welcome to episode 158 of Martha Runs the World. Thank you so much for joining me this week. My guest this week is Sam Visnic. He's a certified massage therapist specializing in neuromuscular and clinical massage and certified corrective exercise therapy. That's a mouthful. So he is going to explain all of that and what it means and how it can help us if we run into big time trouble. Also, Tales of the Trail takes a bit of a turn this week, and I'm going to tell you all about that later in the show after the interview. But first, here is Sam Visnic. Well, welcome to the program, Sam Visnic. He is a neuromuscular therapist, and he's here to help us not have the pain that maybe we have and to keep healthy. Hi, Sam. How are you?
Hey, Martha. Glad to be here. How are you doing?
I'm good. I'm doing very well. I want to ask you, what is a neuromuscular therapist?
Well, this is an interesting topic. There's a lot of ways to describe it. I think neuromuscular therapy in general is an approach to doing soft tissue therapy, but it does extend more, and it depends on who you're talking to and where they're from. In America, neuromuscular therapy is a little different than it is, for example, in Europe. In Europe, it's a wider, broad, I would call it an umbrella term to work with lots of different therapies that affect the neuromuscular system. So obviously it's a manual therapy approach like soft tissue therapy and massage work, but it does involve things like looking at someone's movement, prescribing exercises, perhaps, looking at their nutrition, a lot of that stuff. Here in America, it's mostly been kind of coined as a massage technique. So I'm of the kind of like more traditional European model of neuromuscular therapy, where we look at a lot of different facets of someone's issue. And of course, manual therapy and massage therapy is definitely a part of that. But I'm on that side of things.
That makes a lot more sense to look at the overall picture because, you know, massage is great. And I've had that. I had surgery in October, and I've had the massage with my physical therapist, and that helps a lot. But you also have to look at the overall picture. You have to look at diet and lifestyle, everything. It's all a complete package.
Yeah, and pain in particular, and this is what we have to look at with the research, is that it classically has just been too much associated with structural biomechanics. And pain and structural biomechanics are actually two different fields. Pain is more of what we would consider to be in the realm of neuroscience, and how the brain is interpreting information that's coming from the body. And certainly there are orthopedic and structural issues that go along with that. We all have, rolled an ankle and had it look like a softball. That makes sense. But, and that's more on the acute side of pain. My specialty is in chronic pain, and chronic basically means that when the tissue has healed, and most experts will agree that that's in 6 months of time. But of course, you have to look at this based on the kind of injury you had. A muscle pull is going to take a few weeks. Severe damage could take months to recover from. But once that tissue has healed and you're still feeling pain after the expected time of healing, this is a completely different animal. And that's the kind of work that I focus on. And yes, you absolutely have to look at multiple areas in order to address that.
Oh, see, that makes a lot of sense to me. Thank you for explaining that. That makes a lot of sense. And your work makes a lot more sense to me, and it's a lot more logical to me. Thank you very, very much for that. I was hoping I would say, don't say it's a replacement for surgery if you need it, for example.
No.
Okay.
I think that's unfortunate when people get too far into this. I mean, and this is why I'm going out doing a lot more podcasts, because the way that people look at things is based upon these small focal points and views that we see through things like social media. Mm-hmm. And I will even admit, when I do Instagram, what most people like to see is looking at exercises, stretches, and manual therapy, but it's only such a small portion of what we actually do that works in reality and in actual practice.
That is such a relief to me. I had hip replacement in October, and I tried everything. I tried all the alternatives and everything, and it worked for a while. I did all the stuff. It worked for a little while when it first started, and I'm a pretty active person. I'm healthy and everything.
And it just got worse and worse and worse until the point that I had to have surgery. And now it's like, I don't have any pain at all.
Yeah, absolutely. And, I think that the way that I look at these things too is that we have, I think for good reason, for better or worse in some cases, that people have become a lot more skeptical of medicine as a whole. And for the most part, it's just because they're seeing more facts about certain things. Not every case requires surgery. There's definitely cases that require surgery, but also it's more dense than that. Like, for example, people ask me, hey, I really don't want to have my knee scoped, or I really don't, I have degenerative hips and I really don't want to avoid a hip replacement. Can your work help me? And I'm like, well, we have genetics, joints are going to do what they're going to do. They're going to degenerate as they normally do. Arthritis will develop. It doesn't mean that we're going to have pain. Mm-hmm. So we can alter some of those things. We can optimize movement. We can improve soft tissue health. We can calm nerves down, and, we'll do what we need to do. And if you're an athlete, then you're going to get more mileage out of your body. But certainly at a certain point, the joint is only going to take so much. And, when it's gone, it's gone. But hopefully by doing all of the work that we're doing, either number one, we can get more mileage out of it. We can get less pain. And obviously that's at the end of the day, what a lot of people are looking for is not having their lifestyle altered as a result of pain, but also get you in a better situation for post-surgery. So a lot of people don't consider that, is to do as much as you can before you have a surgical procedure. So you're in a better place after surgery. This is another kind of novel idea. It's not always necessarily either it works or it doesn't. It's like, to what degree and how is it going to help me and prepare me for what's going to be necessary after the surgical process? Because certainly when you go into these things with more strength, more function as best you can, because obviously pain does limit some of that functionality that you're trying to improve, you're going to be walking out of there in a better situation. And I think that happens a lot with fitness populations. They tend to recover much better after surgery than people that are not in any kind of fitness endeavors.
You are absolutely right. I was using crutches, leaving the hospital with crutches. I didn't want to use a walker at all. I said, no, I'm not using that. I'm going to use crutches because I know how to use them. And they were shocked at how well I used them and how well I was able to walk out. I attribute that to the strength that I had going in. I'm older, but I'm not a weak person. So, and then 2 weeks afterwards, I was back to work.
Yeah, I like, in particular, having these discussions is great, talking about, and I've got an ultra marathoner that I'm going to be talking with on my podcast as well, is that this goes into what we call pain neuroscience aspects of this work and why I teach people about pain. The more somebody knows about pain, the better, number one, their coping skills are going to be with pain, and two, the less threatened they are by pain. And this has a lot to do with, in particular things the neuroscience talks about, like the gate control theory, which we know that the more that somebody worries or has concern about an area where they have pain, the more pain information is actually let up the spinal cord to the brain, and the more they feel threatened by it, and the more pain they get. So athletes tend to respond differently to pain, aches and pains, than regular everyday people do. And absolutely. And the recovery is going to be affected and impacted by that. Now, of course, that varies on the situation. If somebody's catastrophizing and feeling like they're never going to get back to their sport and so forth, I mean, that stuff certainly happens with athletes as well. But the neurology functions differently in athletes. And we do need to capitalize that, on that in the therapeutic process as well. So that's definitely been my experience. And I've worked with elite level power lifters and bodybuilders, and certainly I've seen people with bone on bone, I really hate that term, but basically nothing left in terms of cartilage, and breaking 800-pound deadlift records. I mean, there's a difference between the structural mechanics and the nervous system and the interaction between the two for certain.
That's incredible. Isn't it amazing how much pain we'll put up with?
Yeah. And the individual's ability to contextualize it. I mean, and that's the fun part of talking about the neuroscience. And this is so far just kind of into the deep, I'd say in the weeds of what my work is like we're just talking about massage, right? Or just talking about doing exercises. But a lot of it has to do with altering the information, these inputs that we're putting into someone's nervous system. But then we also have the brain's interpretation of those inputs as well. And so people don't really understand when it comes to chronic pain is that we're past this Descartes method of, when, the old model of when you put your hand on a fire, in a flame, that the pain receptors in your fingers are actually the thing that's generating pain. That's not how it works. What's happening is that we don't have pain fibers or receptors in the body. What we have is information receptors, pressure, temperature, strain, stretch, fatigue, etc. And those receptors are sending that neutral information to the brain. And I say neutral, it is what we call nociception, but it's only potential. And when the brain organizes, and there is no one part of the brain that actually processes this information, there's multiple areas of the brain, and it all comes together to determine, is this a threat to my survival or my tissue or whatever? And if it is, it sends this noxious signal to your conscious brain called pain to get you to take action. And so that's how it works. So there are many contexts in situations where we have tissue damage that we don't feel pain. Or we remind people, have you ever woke up and looked down and you had a bruise on your leg and you never know where it came from? I mean, there was tissue damage there and there was no pain. And there are other situations where, people have virtually nothing happening with them. 25% of the population with chronic pain has never had an incident that something occurred, an injury or whatever, and chronic pain just develops. And there's no tissue damage through MRIs and X-rays. These people have been studied, and there's no reason why somebody would be feeling pain. So pain is very complex. And I think that it behooves us to look at all of the different areas in the neurology that contribute to this situation rather than, getting stuck on structural biomechanics, even though it is definitely an important factor.
A lot of pain is caused, I would imagine, but just from wear and tear.
Well, that's the interesting part, is that we say that, but yet the research does not support that. So when we look at the curves on reported incidents of pain issues, you're going to find that for the most part, arthritis continues to increase as we age. And if you look at a chart, it's going to be linear. As you get to your 60s, 70s, 80s, arthritis continues to go up. But reported incidence of pain factors actually goes up and it starts to drop down in, I think, about the 60s. So it does not reflect that. We know that the two things have some relationship, but not the relationship that you think. So that becomes kind of problematic when we start looking at saying, arthritis causes pain. Well, that's not really true. I mean, it tends to coincide with it but also it's like one of those factors where people have other things going on. So that's what I always like to talk about with people and help them understand that these issues that are oftentimes associated with pain really aren't. It's far more complicated than that.
Oh boy. Yeah. It sounds like it. If I go to you for help and let's say I have back pain that I've never found any success, what are the first steps that you take with me?
Well, we're always I'm going to say first and foremost, my process is probably going to be a little different than most practitioners because I'm usually not the first person that someone sees. So I'm usually the person fourth or fifth down the line. They've already gone to their doctor, they've gone to physical therapy, and they usually have gone and done, some alternative therapies, maybe some chiropractic, massage, and acupuncture. And if they get to me and they're not better at that point, there's a little bit of digging that needs to be done because those health professionals, in particular, their doctor, physical therapists, et cetera, are not incompetent. They had screened the person for the things that are the most obvious contributors. But there are things that I know based on my experience that have been missed. So I always want to cover those factors. So I always go through someone's history, say, what have you done? What did the doctor tell you? What diagnosis do you have? And throughout that process, they're going to tell me how this has progressed. And then, of course, I'm going to get a feel for what they believe about their pain and what their experience has been and what works and what doesn't work. Because a lot of people at this point will clearly be able to tell me, this makes me feel better. That doesn't make me feel better. So I'm going to listen to that. And they say, you know what, I don't know why, but when I do exercises, I feel better, but I don't respond really well to massage therapy or vice versa. And people go, exercises and movement make me hurt, but massage therapy makes me better, but it only temporarily works. So there's always like these things that we start to find in the fleshing out process. And then I'll look for some additional factors that don't tend to be looked at. Like, for example, a lot of practitioners will tell you need to reduce your stress. Well, that's generally meaningless because there's a lot of things that can contribute to stress, and there's different kinds of stress. So if that's the case, we need to dig into that a little bit more and find out what that means. Also, one of the things in the chronic pain research that is one of the most impactful things that impacts chronic pain that people don't talk about is sleep. So there's dozens and dozens of studies that show that pain tolerance and coping skills and mechanisms are greatly worsened by a lack of quality sleep, and there's specific criteria for this. So when I go through sleep evaluation on the intro induction, I even just a simple 5-minute questionnaire where I talk with, I go over some of these elements, and then I follow up and ask somebody about sleep, will oftentimes see people that are dealing with situations of unresolved chronic pain are often very poor sleepers, and these issues are not being addressed. Not necessarily from a factor of, hey, go to bed on time and get better sleep, but some of these people are dealing with sleep apnea issues, chronic insomnia problems, anxiety, depression, and worry. And these things have been unaddressed. And here they are, with one of these top factors that contribute to the chronicity of chronic pain, but yet they have never seen a single healthcare practitioner for these issues. So I always look for those things. And I'll tell you what, I find them very commonly. And then when we do that, we start to kind of dive into the evaluation process of how they're using their body. And not only the area, also one of those common things is if somebody has back pain, I'd have to say probably the majority of the time, the practitioners they work with had only worked on their lower back. And for good reason, that's where the pain is. Where there's smoke, there usually tends to be fire. But in the structural mechanical world, in terms of biomechanics, if you're well on top of things and you tend to read a lot and do a lot of research, we know that everything in the body works as a unit, as a whole. So if somebody gets relief from doing their chiropractic adjustment or their massage, but it doesn't last, it's very important not only to address the factors that I talked about, but also to look at other areas of the body that the way that person might be using their body is contributing to that chronic tension problem or that structural stressor to continue coming back. So it's not uncommon to see people with rib cages that don't move very well and they have stiffness, but yet they have hypermobility in their lower back joints, or, they can't sense the floor very well, and that's altering the biomechanics in their hips and their lower back. All of these things. And I know that sounds like a lot. But it's definitely a process by which we go through and take a look at everything, rather than, again, getting locked into this model where we're just looking at the structural mechanics of the area where the pain is. And especially if I'm the fifth or the sixth person down the line working with somebody, I'm certainly not going to keep looking at the same thing that everybody else has where it hasn't worked.
No, that wouldn't make any sense. And what you're saying makes sense. Look at everything they're doing. Maybe are they walking properly are they running improperly? Is their movement incorrect? A lot of runners, their running movement itself is completely incorrect form, and it can contribute to so many injuries.
Absolutely. And in antagonistic activity, by no means, I work with a lot of, runners, I would say more recreational runners, certainly, but some ultra distance type runners, but also work with golfers. And by no means I'm an expert on the golf swing or, teaching somebody how to golf or teaching them how to run. That's not my business, but I certainly always connect with their coach, because their coach will be able to tell me this is what I see with them. And, as we go through the evaluation process and see what body parts are moving well and what aren't, and also looking at the factors that are just sport related. And now clearly running is a quadricep dominant activity. And we're going to be looking at how much antagonistic exercise work the person does. Is their glutes and their hamstrings getting enough stimuli to antagonize the high volume nature of the running sport? And if not, we're going to start to see, I guess you could say, wear and tear patterns that are associated with the sport. And we're definitely going to work to antagonize those things so that the body gets a break from that position. And if it doesn't, then we're going to see repetitive strain issues and those common factors that are sport related.
How much or how many injuries or pain problems do you see come from overtraining?
I guess that depends on the sport. Certain sports definitely lend to have more issues with it. Golf is so predictable. If you got a right-hander that comes in, you're always going to see the same kind of body pattern because they're swinging in the same direction repetitively all the time. They rarely, if ever, get antagonistic activity, especially in the gym, because they're obviously not going to swing the golf club to the opposite direction. So there's a lot more aggressiveness I have toward antagonizing their pattern in order to get them some relief. With runners, we see obviously very similar ones: foot and ankle issues, knee. Almost the majority of it is an issue with too much adduction and internal rotation of the hips, because those are the muscles in particular that, that's the direction you go on heel strike. So a lot of times we're going to be looking at making sure that there's sufficient proficiency of the muscles that decelerate internal hip rotation and adduction. So we're going to be looking at, obviously, at all of the glutes. We're going to be looking at the ability of the hip to glide in the socket as well as it needs to be. And of course, the foot mechanics as well. Do we have adequate dorsiflexion of the foot? A lot of times you're seeing short and tight calves. The plantar surface of the foot has adaptively become shortened. Do they have enough arch support? All of those things. And also in particular with runners, we oftentimes have to look at something that does not get addressed very well, is appropriate rib cage activity. Is the rib cage moving in all three planes of motion? Of course, most of them, I don't look at more what I would call arbitrary things, which is core strength, like how long somebody can do a plank, or these things don't really correlate with reduction in injury and improved performance. It's more about the ability of certain aspects of the spine to be able to reciprocate and alternate their movement to basically reduce energy output. I think we really know when it comes to sports that are especially endurance-based, the easier your body can move, the less energy it takes to move it. And that involves, of course, having adequate joint mobility as well.
Yeah, that makes sense. So tell us about your podcast.
Well, the podcast is interesting. I've been at this for about 20 years now. And for me, I've been mostly kind of, I would say, in my cave, my wife says, just kind of like doing the work. And little by little, I kind of wrote articles, did YouTube videos and so forth. And, over the years, people have just kind of pushed me to, hey, get out and start talking about this stuff a little bit more. And I had wrote a book, an ebook, about 2 years ago. And it was really kind of like a compendium or a living document that I wanted to like talk about and stick all the research of the things that I had been looking at. And I named it, why didn't my doctor tell me this? It was mostly because it was a constant phrase that I kept hearing from people, was like, this is really good information and this could be very helpful in making informed health decisions. Why did my doctor tell me this? And, that's a big topic all to itself, which ultimately is a result of time, energy, resources, et cetera. But it's good information that I think people need to know and help synopsize it. And of course, that kind of led into the next thing, which was, this is all great information. And, when we look at these different fields, when it comes to sleep, when it comes to orthopedic issues, we oftentimes are not getting the nitty gritty details on all of these things. And, it kind of came up as a topic almost always with naming something becomes difficult, was somebody's got to know this. Like, so who's the expert on this topic? And that kind of became the name of the podcast, Who Knows This? And we're not going to talk just purely about issues around pain, although the first couple of episodes, I've really wanted to extend into certain areas. So, for example, one of the first places that I went was I actually talked to my wife, who's a clinical nutritionist whose expertise is in gastrointestinal disorders. And we wanted to talk about inflammation because we hear about this so much. But what is inflammation? What drives inflammation? And there's a lot of emerging information out there that talks about, gastrointestinal based issues that we have from bacterial changes in our environment and our nervous systems. And this can create a sense of underlying propensity toward inflammation that can certainly derail your efforts on reducing nerve sensitivity when you have chronic pain. So we talked about that. And I also was very interested in what is the gold standard for improving sleep. And unbeknownst to most people, and this kind of came as a surprise to me years ago when I figured it out, which was the gold standard for improving sleep and insomnia is actually cognitive behavioral therapy of a certain version of it for insomnia, which is amazing to me, is that it hands down beats medications, even though medications are the number one thing that are oftentimes used for improving sleep. So I found myself a CBT therapist who was an expert PhD out of Arizona, and I interviewed her and just trying to put together resources for people to help them understand what is really out there and resources to be able to help themselves.
That is, I just looked up your podcast. So yeah, I will have a link to it. And for anyone who wants to check it out, because it looks pretty amazing. And I'm glad you just started it. It's great. Just keep it up, because podcasting is fun. It really is fun.
I've been enjoying it so far. Great discussions with people that are really all trying to move in the same direction, which is what's the truth out there, and how do we get these resources in front of people to help them, especially when they feel like they've tried everything and they haven't been able to get results.
Yeah. Well, I'll tell you, I found that I got a much better sleep. When I got my surgery, I realized I needed a new mattress. And so I got a new mattress. I got a really awesome mattress, and I'm sleeping great now. So if you're not sleeping good, buy a new mattress. For goodness sake, get one that fits you, how you sleep. If you need a firm one, get a firm one. If you need a softer one, get a softer one, but get a new mattress because it makes a difference.
Yeah. I mean, I think one of my colleagues had talked about this, and it's like, if you calculate the amount of hours, the average mattress, I think, and some of them now with a great warranty is, 10 years. Yeah. And if you calculate the cost of that, and the amount of hours that you're actually sleeping on the thing, it's not worth it. I mean, it's a pretty solid investment investing in a really good mattress.
Well, you don't have to spend a lot too. There's lots of sales. You can get one at a decent price. You don't have to spend a ton of money. You can get one on sale. And then these mattress stores will deliver them for free because they want to sell. I mean, they're really desperate to give you a sale price. So get one on sale, have it delivered. They'll take the old one out and you don't have to worry about it. It's a good deal. What kind of things are you going to be covering in the future on your show?
I think it'll extend out more into other topics. I didn't, in particular, when I designed my idea for the podcast, a lot of it was I have a lot of personal interests, and especially in topics that in health in particular, because it's just one of the top things that we're all dealing with, is that the better our health is, the better almost everything in life is. So I definitely want to be talking about other aspects of that. I think that there's so many people that are dealing with gastrointestinal disorders of some degree, IBS and so forth. And that extends into other areas where people have health issues with their neurology. We want to talk about how some of these factors are interrelated and what I call a cross-disciplinary way to things that are, health challenges that people are doing everything they possibly can to avoid, such as dementia. And there's strong ties to gut health and dementia. So I want to talk about those things and help people understand how a multifaceted, multidisciplinary care model can help. I brought on a physical therapist who this episode will be out soon that's going to talk about occlusion and basically teeth. So we don't spend as much time on the dental aspects. We tend to think about dentistry as just kind of like, hey, keep your teeth straight and avoid gum disease. But the upper reflexes in your neurology and your mouth in particular, and how your teeth fit together, can have dramatic and profound effects on the postural chain and the way that your nervous system functions. So we've got all these areas that are very separate from each other, but really have a common theme. And that's our neurobiology is all working together in an integrated way. So I want to talk about that stuff clearly, but eventually we'll start kind of running out of steam and things to talk about in that realm. But I want to have a resource database for people in terms of all of those topics. And then I want to start branching out into more. I have an affinity for the cognitive therapies, talking with actually how do we go about this process of reducing the stress that we have in our lives and break through the stigma that's oftentimes associated with mental health, and working with mental health professionals and so forth, because these are really the issues that are plaguing us. And all of these things, when we kind of combine them together, is going to improve our quality of life.
Yeah, I think that's excellent. That's really good. And you have a limitless amount of topics to choose from.
I hope so. That'll keep things going for a while. But certainly being able to niche myself into specific types of problems as well.
Mm-hmm. Sure. Now, what are some everyday habits that we can adopt to help us stay healthier? I
think it's the basics. What I've noticed is a common trend these days of just kind of like the whole biohacking community. I have nothing against that at all, but it's more reflective of the idea of biohacking, which somehow we're going to kind of hack our way around certain things that are just necessary for health. And I think that becomes the problem, that the glitz and the glamour of the marketing and so forth has really gotten people to become distracted from the things that really actually successful health practitioners and clinicians do to get people better. Yes. And I can't tell you that almost always it's, you've got to sleep and do whatever you've got to do to, get a sleep study, go to a sleep doctor, mattresses, whatever's necessary, get adequate sleep. And then if that obviously is going to get you entangled in the other areas around lack of quality sleep. If you're dealing with anxiety, depression, link up with a therapist or a mental health professional to talk about those things to help get solutions. You need to eat well. And before we start getting into gluten-free everything, food sensitivities, everything, that stuff's important. But people just need to make better food choices in general. And I think, nobody in America now does not know what healthy things are. We need to eat more vegetables. We need to eat less processed foods and junk. And certainly we need to get out and move. And again, I always say before we get into corrective exercise and having specific movements that are dealing with our postural issues, first of all, how many steps a day are you getting? Yeah. If you're not getting more than 1,000 steps a day and you're not doing them not because of pain, right? If you have pain, then obviously you need to handle that. But if it's just, hey, I'm just not getting that in, it's time to make those changes. You will be utterly amazed at how less you have to far dive into super specific types of therapies when you are covering those basic elements and you're verifying that you're doing them. It is amazing. And that way, when you do your chiropractic, when you do your physical therapy, when you do your massage work, you will find significantly improved effects from those therapies, and the work will stick because you're doing the basics. Yes. And I'm not saying that the basics are easy to do. I'm saying that the basics are the foundation, and they're what's necessary to be able to verify that we're getting them in.
I agree. People seem to like real fancy, weird eating diets that they have. I mean, I'm older. I'm 62, and my whole lifetime I've seen weird eating diets where you starve and then you binge and then you starve and then you binge. It's been going on for a long time. It still is. No fasting. No, that's starving. I'm sorry. It's the same thing. Same thing as far as I'm concerned. No, just eat right. Eat more vegetables. Try not to eat too much of this. You can once in a while. Try and eat more healthy stuff and just balance it out. I mean, this isn't rocket science here. It's pretty basic. I mean, I've lost 17 pounds since my surgery, because now I can move and now I can eat right. And now it feels pretty good to move. This isn't that hard,
Yeah, the actual mechanics of what is necessary is not that hard. And now we get into the biopsychosocial reasons why it's difficult to implement. And that's where, like I said, we start to get into, and I did an interview with a guy named L. Michael Hall. He's written 66 books in the neighborhood of doing things like neurolinguistic programming and behavioral change technologies. And the idea is what's happening there in our neurology. How can we know something, but there's a gap in the knowing doing? And there's a lot of things that are internally happening with our systems, and namely because we can't take a thought or an idea or a concept and ground it in our neurology and act it out. And that's where these therapies are very helpful for people. Sometimes those of us who have internal structures in our head where we think about something, it makes sense to us and we could just start implementing it. There's a lot of people that don't have that structure. So we need to build it in them. We need to teach them to successfully do that. And the problem is, of course, that a lot of us who do have those structures where we just know and then do, we don't know how we do it. We just do it. And then so we look at other people and we're like, you should just do this. And they have no idea what we're talking about. So, there has to be a conversion there. And that's where, technologies that will assess people that are successful in actually knowing, doing, and crossing the gap and figure out what they do in their mind. What do they believe? What do they think? And then start to kind of teach that information to people that need to cross that gap. And that's a therapy. That's something we can do something about. And, there are a lot of experts on this topic, and we just need to link up the right people who have that problem with, the therapists that can help them out.
Wow. That is amazing. What a great explanation. Thank you for that.
Yeah. And I can't deal with the you should just reduce your stress attitude.
Yeah, true.
And we know that it's true, and we all say it. Everybody does. But the challenge is that I'm like, all right, if I actually had to teach somebody how to do this, how would I do it? There has to be a structure to it, just like virtually anything else.
Well, plus a lot of us live in a situation where we really can't reduce our stress right now. We just have to live with it and deal with it other ways.
There you go. So there's
kind of a harsh world right now.
There's only two ways to change stress. All we do is we can change the environment, right, to remove ourselves from the stress, et cetera. Or number two, we change our nervous system's response to the stress.
Yeah, there you go. There you go. That's it. We just have to just deal with it in different ways and just look at it in different ways.
It's fundamentally no different throughout human history. There's always been struggles in the human race, but we've gotten through it by our resilience and adopting internal behaviors.
That's it. Exactly. I love that. Well, I really appreciate you being on the show. This has just been such a pleasure and really, really great. When you responded to the podcast guest thing, I really wasn't sure what to expect. and I am so pleasantly surprised. This is amazing. This is, I love that you're based on science, which is what I am. And that's what I love and appreciate, and totally am really into this. I'm going to listen to your podcast, and I already subscribed. So I'm going to be listening to it every show. I hope that you have great success with it and continued success with your business. And thank you so much.
Yeah, thank you. We'll have lots of evidence on there, of course, but a touch of anecdotal just to keep things interesting and progressing forward.
Absolutely. It makes it fun and interesting, definitely. And you have a great rest of your day.
Awesome. Thank you so much.
Thank you so much, Sam. That was it was educational. I have to say that. I learned an awful lot. It was interesting and fascinating and everything because I didn't know anything about that. That's a world I didn't even know existed. So that is terrific. So if any of you are having big time problems like that and you're not getting any help, there is light at the end of the tunnel. And all of his links will be on the website, martharunstheworld.com, so you can look up any of the information there. And if you're not getting the help you need, remember, you are your best advocate, and you need to keep searching till you get the right answers. That is the way it is in medicine, and we need to be our best and our most active advocates. We need to fight for ourselves and keep going. It's the only way we get things done in this world. All right. Now, Tales of the Trail is next, and I'm going to change things up a little bit, so stay tuned. Now, with Tales of the Trail, I am changing things a little bit. I started thinking that I don't want to just cover races and cover the winners of races, because that's not what Martha Runs the World is about. I love the winners of races. I love fast racers and the fastest runners. I think they're awesome and amazing. And of course, we all look up to them. They're incredible. But that's not really what my podcast is about. There are so many podcasts that only cover the fastest. There are so many magazines that only cover the fastest. There are so many books that are only written about the fastest. There are events that are only about the fastest. And that's not what this podcast is about. I'm not going to be talking about races and just saying the top 3 winners of the races. I'm not going to do that anymore. I want Tales of the Trail to be about the listeners sending in their race reports. If I don't get race reports from you, I won't do Tales of the Trail. That's why I want you all to send in your race reports. Okay? So it's real important that you send me your race reports. If you did a great race, if you did a not great race, if you didn't finish your great race, or if the race was really, really hard, if you had a real hard time and it was an awful race, if the weather conditions sucked or whatever, send it. I'll talk about it on the air. Let's commiserate together, because we've all been there, really. We have all had sucky races, and we can feel your pain together. So send in your races, all right? And I'll talk about how you can do that in a minute. But I do have one race report, and that's from Jason Lehrbaum. I hope I pronounced your name properly. Jason he races every weekend. I swear he does. He's one of those that goes out every weekend. He really supports the Bay Area running scene and racing scene. He's a cool fellow. He races. You'll see his picture on the website. He wears a goofy colored wig when he runs, and he's just an awesome guy. He wrote a little bit about the Brazen Races Coyote Hills half that he did this past weekend in Fremont. And Brazen Races are a great race company in the Bay Area. They do some really cool races, mostly in the East Bay. They do up to half marathon distances. They're a very, very neat company. I like them a lot. This is what he wrote. Today I ran a half marathon with Brazen Racing's Coyote Hills. I typically don't prefer the flat pavement runs, but since they changed up the course some, I had to try it. This definitely was not a flat half. It was like 800 feet of elevation. Special thanks, of course, to the volunteers for being there handing out food and drinks, and lots of beautiful weather and a beautiful course. What more could I ask for? And the pictures are gorgeous. It was sunny. It was cool because it's winter, and it just looked absolutely beautiful. And the Coyote Hills are this great open space area in Fremont, which is in the South Bay, East South Bay. And it's rolling hills grassland. There aren't any trees there. It's right next to the flats, the salt flats of the bay, and it's just a beautiful area. It's really neat. It's very unique to that part of the Bay Area. So thank you, Jason, for sending that in to me. I really appreciate it. It looks like you had a great time, and it was a great day. So if you want to send in your race report, and I really, really would love it, and have it featured in Tales of the Trail, please send it to me at martharunstheworld@gmail.com. Send me your name, the race name, the date of the race, the distance, and why it was a great race or why it wasn't a great race. And I will feature it in Tales of the Trail. And that is today's Tales of the Trail. Okay, don't forget we have a new beginning running series on the YouTube channel. It's just for beginning runners, for your friends who always wanted to run but never knew how to start. It's just for them. This week is the second week that's out. And I have to tell you, I am not used to filming. Filming is really hard. It is so hard. I never realized how difficult filming would be. Podcasting is not difficult. Filming is difficult. So forgive me in my faux pas in filming. I'll get better at it as I go along. I promise I will. I really, really will. Check that out on the Martha Runs the World YouTube channel. Tell your friends about it. Please like and subscribe and all that fun stuff that they always say on YouTube that I forget to say. I'm such a noob on YouTube. I'll tell you, the noob on YouTube. All right, so that is there. And and the website is martharunstheworld.com. And go ahead and please become a patron if you can. It's only $2 a month, and you get free extra episodes. If you donate more, you get free swag. All right, so that is that. And then until next week, let's tie up our shoelaces and go for a run.